Hello friends, again Dr. Ravindra Nikalje. I'm a consultant nephrologist and a kidney transplant physician at Apollo Hospital, Navi, Mumbai and Apex Kidney Care, Vashi. Again, I'm going to educate you today about a very important topic, that is signs and symptoms of chronic kidney disease or a kidney disease, and how to identify them so that you can diagnose it at the earliest stage and you can get it treated at an earlier stage. So number one, it is a myth that kidney patients have a lot of symptoms. Usually kidney diseases are asymptomatic, or you do not have any signs and symptoms in the very earlier stages of chronic kidney disease. And symptoms and signs start coming only after you lose a significant amount of kidney function. Almost 50% to 60% of the kidney function is already lost before you start manifesting the symptoms or signs of a kidney disease, and unfortunately that becomes too late to reverse the pathology in your kidneys. So my dear friends, you should understand that kidney diseases are by and large asymptomatic, especially chronic kidney disease. Now, what are the exact signs and symptoms? So a commonest sign and symptom that you will have is a swelling. So any new onset or sudden onset of swelling around your ankle, swelling below your eyelids, or swelling on the face indicates that you are retaining a lot of water in the body, and that can be a symptom of underlying kidney disease. Any changes in the urinary flow, any frequency of urine, any reduction in the urine output, any increased frequency of urination at night are again a signs and symptoms of an underlying kidney disease. So all these symptoms, if you have it for a long time or if you have recently developed, please, you need to visit your physician. You need to get a basic kidney test like urine routine sonography or a kidney function test and evaluate it very urgently. Unexplained loss of appetite or nausea, vomiting. Now these are very common symptoms, and most of the times the tendency is to neglect these symptoms. So unexplained loss of appetite, unexplained nausea, vomiting, especially just by looking at food, if you have a feeling of nausea or a vomiting sensation, sometimes these are signs and symptoms, presenting signs and symptoms of a chronic kidney disease, especially advanced chronic kidney disease. Unexplained fatigue and weight loss. Now again, these symptoms are routinely ignored by common people, thinking that fatigue is common, and there so many reasons are given for the fatigue or tiredness. So unexplained fatigue, tiredness or weight loss are again signs and symptoms of an advanced kidney disease. So these are the common signs and symptoms, my dear friends, to identify and get investigated at the earliest. In addition to these, the late symptoms are breathing difficulty, decrease in the urine output, very high blood pressure, especially headache, or a visual disturbances due to the high blood pressure, then decrease in the level of consciousness due to high blood urea or creatinine levels. But these signs and symptoms are indicate a very advanced kidney disease, and usually you need to get admitted and you need to get investigated very, very urgently. So please remember, chronic kidney disease or kidney disease are by and large asymptomatic. They do not have much symptoms in the earlier stage, and that's why most of these diseases get undiagnosed or untreated. If you need any more information about how to identify kidney disease at the earliest, please visit my website or please feel free to contact numbers mentioned below. Thank you.